My patient XYZ, 30 years old, married male, educated up to class 10th, EC technician by profession, resident of XYZ, admitted through outpatient department on 18th of April with presenting complaint of exacerbation of pre-existing asymptomatic red raised lesions all over the body, sparing the feet, flexures, palms, and the soles for last 20 days, associated with white scales over these lesions for last 20 days. No history of pruritus, photosensitivity, and burning over these lesions. Patient had a history of some skin disease for last 7 years. According to my patient, he was in dual state of health 7 years back when he developed typhoid fever, told by the physician. Fever was sudden in onset, high grade, continuous, not touching the baseline, and not recorded on thermometer by the patient. And not associated with any sore throat, dry cough, with the upper respiratory tract infection, with lower respiratory tract infection, with ear discharge, with burning micturations, loose motion. Fever relieved within a span of 12 days. Following this episode of fever, patient developed generalized eruption started from the hand and the feet associated and spanning the palm, soles, face, and flexural area as well as the scalp. For this eruption, patient took topical medication as well as oral medication. The name of the medication was not known by the patient. This eruption settled within a span of 20 days, leaving behind a normal skin. Patient remained in the remission for last 3 months and developed similar episode, but this episode was associated with the involvement of the scalp hair as well as associated with the white scales over the lesions. Scale was copious in amount, adherent to the lesions, and removed easily by the patient and after application of topical medications. And patient had multiple episodes of remission and relapses during these 7 years of the same condition. And his last episode started 6 months back, which was also sudden in onset and started from the hands and the trunk, and gradually spread to involve the whole body within a span of 6 months, with the exacerbation of these condition for last 20 days. This time eruption was associated with the history of a photosensitivity, which he described as increased burning over the lesions of the feet following going into the sun, and which get settled after coming back into the shaded area. This episode was associated with withdrawal of topical medication. Patient did not give any history of joint pain, stiffness, swelling of the joints, no history of difficulty in chewing, and no history of difficulty in bending forward. Patient did not give any history of postural interruption over the body, no history of swelling of the whole finger, no history of difficulty in walking. Patient did not give any history of development of the whitish patches over the body, and no history of orogenital ulcerations and breast discoloration of the fingers. Patient did not give any history of a weight gain, but he gave the history of weight loss, which was 10 kg according to the patient in last 6 months due to decreased oral intake. No history of lumps and bumps, and no history of night sweats, low grade fever associated with this weight loss. Patient did not give any history of postural eruption during these 7 years, no history of increased thickness and redness of the ligands, and no history of generalized erythema and redness of and scaling of the body during these 7 years period, and associated with the periorbital and the pedal edema. Patient this is the first time admission of the patient in the hospital, and the patient did not give any history of oral medication, and he started for the first time oral medication during this admission period. And no history of skin biopsy, and no history of phototherapy, no history of any expensive injectables. Patient past medical and past surgical history as well as systemic history was not remarkable. Patient is AC technician by profession. He belongs to a low socioeconomic status. He and along with his brother is the sole earner of the family. And patient disease has moderate impact on his daily quality of life. He find difficulty in interacting with the people and in going to work because of his disease condition. On examination of the patient, a young male sitting comfortably in posture cooperative with the examination. His On general physical examination, his BP was 130 by 70 millimeter of mercury. His pulse was 70 beats per minute, regular good volume without radiofemoral delay, and his sclera was dirty. Oral cavity was there was poor orodental hygiene with the yellow stained teeth and the whitish plaques over the gums and the whitish coated tongue, and there was no pallor, jaundice, and lymphadenopathy, and appreciable. And thyroid was not enlarged, and the patient had pitting edema over the feet, which was extended up to the midchain. And on cutaneous examination, there was a diffuse involvement of the body, sparing the face and the axillae and genital area. And there is generalized of the whole body, showing multiple erythematous papules that are diffusely scattered over the body. Some are coalescing to form plaques, with the largest plaque involving the bilateral lower limbs, and approximately 7 into 10 centimeter in size. Plaque was non-tender with the normal temperature gradient and was erythematous. And there is presence of whitish scales over these papules in the plaques, as well as peeling of the skin surrounding these plaques were appreciable. And Osprey sign was negative, and uh, s- um, on examination of the scalp, the scales was loosely adherent to the hair shaft, and male examination shows subdermal debris, no onycholysis, splitting, fitting of the nail, there is also focal thickening of the skin of the palms, as well as soles, and the soles were dirty. Test of the cutaneous examination was normal, and the systemic examination was also unremarkable, with a normal vesicular breathing and a heart beating fifth intercostal space middle to the mid cerebral line, and no viscomegaly appreciable. Thank you.